Welcome everyone to tonight's ACTS2 workshop, Healthy Eating on a Budget for Older Adults with Dementia, What Caregivers Need to Know to Make It Work. I'm Dr. Rob Glukoff, servant leader of the ACTS2 project and professor of Florida State University, College of Medicine. In case you are unfamiliar with the term ACTS2, it stands for African American Alzheimer's Caregiver Training and Support Project 2. Folks, I am very enthusiastic about the prospects of tonight's workshop. Our featured presenters will provide practical and easy to use information about preparing nutritious meals on a budget for family members with dementia. Caregivers want to know how to create appealing meals for their loved ones with dementia at a reasonable cost. However, they typically receive little or no information about which foods to buy. They receive little information about best ways to prepare healthy meals and how to stay on a budget. Here is your opportunity, folks, to learn all about it. Workshop presenters Afaf, Qasem, and Laurie, Osgood, leaders in nutrition and health promotion, will cover key topics such as strategies for meal planning, cooking nutritious and tasty meals for loved ones with dementia, and financial tips to help stretch the dollar. ACTS2 Coordinator Tomeka Norton-Brown will provide information about faith-based skills training and support for dementia caregivers, as well as local, state, and national dementia care resources. Before I introduce this evening's presenters, I want to recognize our partners who have contributed both resources and guidance in the development of the ACTS2 Dementia Caregiver Workshop Series. ACTS2's primary collaborators are the Florida State Primitive Baptist Convention, the Florida General Baptist Convention, the Florida Progressive Missionary and Educational Baptist Convention, the African Methodist Episcopal Church, 11th Episcopal District, and the FSU College of Medicine REACH Project. Turning now to tonight's presenters, we have three dynamic speakers, Afaf Qasem, Laurie Osgood, and Tomeka Norton-Brown. And I have the distinct privilege of serving as moderator for this evening's workshop. Please permit me to share just a few words about each of our presenters. Our first presenter, Afaf Qasem, is Director of Health Promotion, Department of Population Health at Tallahassee Memorial Healthcare. She obtained her bachelor's degree in dietetics and then subsequently a master's degree in food and nutrition sciences at Florida State University. She is currently pursuing her doctorate in public health at Florida A&M University. Afaf is a highly esteemed leader in her profession. In 2019, she received the Young Dietitian of the Year Award and is former president of the Florida Panhandle Academy of Nutrition and Dietetics. Afaf is passionate about person-centered holistic approaches to chronic illness prevention and loves serving as a mentor for aspiring dietitians. How wonderful. Our second presenter, Laurie Osgood, is University of Florida affiliated family and consumer science agent at the Gadsden County Extension Office in Quincy, Florida. She obtained her bachelor's degree in dietetics, followed by a master's degree in family, youth, and community sciences from the University of Florida. Laurie has worked at the Gadsden County Agricultural Extension Service for over 8 years. As an extension agent, she enjoys working with families and youth across the state of Florida and Gadsden County. Laurie's programs in health and wellness and meal planning on a budget have received acclaim throughout rural Gadsden County. Last, Tomeka Norton-Brown is project coordinator of the ACTS2 project. She has worked in the area of survey development and evaluation for the past 23 years. Tomeka has served also as a caregiver for her dear aunt and uncle with dementia and has a passion for helping others. Tomeka has been a great source of encouragement and support for literally hundreds of family caregivers of adults with dementia across the state of Florida. She is also a strong leader by example in her church community. Folks, during the course of the workshop, I encourage you to share questions to be answered after each presentation using the text message function of Facebook Live. We will also have a 15-minute question and answer period following the last presentation. And now we have Afaf Qasem. Welcome, Afaf. It's just delightful, and it's really a great privilege to have you here on our Facebook Live workshop. Welcome.
Thank you so much for having me. I'm really excited to be here and hopefully provide lots of nutrition education and information and answer any questions that our viewers might have. So let's go ahead and get started. So I'm going to be covering the nutrition component of eating healthy on a budget. And of course, my colleague Laurie will be going over the financial planning component. So one really important thing I want to mention before we begin is the benefit of meal planning. A lot of times we hear about meal planning. One thing I will say is it takes time to develop the skill, but you also don't have to do an all or nothing approach. So first we'll go into kind of what are the benefits, what are some tips and then takeaways and how you can actually apply it to your everyday life. So benefits of meal planning is it can help you save money. You can definitely eat healthier. It's less stressful when you know what you're going to prepare for you or your loved one. It helps you save time and it adds variety to your diet. As a registered dietitian, I am constantly preaching the importance of adding a variety to ensure that we're getting enough of those nutrients. So what I would love for you all to think about whenever you're meal planning is a who, what, when, where, why, and how. So we're going to go through the who first. So who are you planning for? Is it you? Is it as a caregiver, it's you and your loved one? Is it something you're doing for a larger group of family? How many people live with you? So thinking about who you're planning for. And then what type of foods do you like or you want to incorporate? It's really important that you know what you like and then also what your loved one likes or the person you're caring for likes or your family in general. Sometimes you might get a lot of conflicting opinions in the household, but maybe you can meal plan on multiple different days for different people. And that's how you kind of find that balance for you and your family. When? So what scheduling constraints do you have and what time of day are you planning for? Oftentimes, we're on the go, we're super busy, we're going from appointment to appointment. It's really important to know where will you be because it will change what you'll take with you, right? So you may not take a yogurt with you if you know you're going to be out for 6-7 hours and not eat it until 3-4 hours later. So maybe you would take a granola bar instead. So knowing what's going on during your day and where you're going to be is super important for planning. And then why? So that was the where also. And then why? Well, it takes time and some effort to plan meals, but with practice, it gets easier. And oftentimes people think when I say the words meal planning, that we mean you need to plan every meal of every day of the week. And that's just simply not the case because it's not reality. We can really start small and build that over time. So thinking about all the benefits of meal planning when you feel like you have no time to plan will help you and encourage you to do so. And then the last thing is how. So how are you going to do that is today's subject. So I'm going to go through all the tips. And of course, at the end, you can ask as many questions as you want pertaining to the how. So let's talk about before you go shopping, and then we're going to follow with while you're shopping, and then when you return home. So before you go to the store, it's really important that you actually make a shopping list and think about how you can utilize the ingredients that you already have at home. Oftentimes, we forget to look at our fridge and see what different items we've left behind before we go to the grocery store. And you do that so whenever you're making your list, you actually know what's in your fridge and you can waste less food that way and less money. So if I know I still have, let's say, 3 cucumbers in the fridge and I don't plan on making a salad or using cucumbers, then of course I'm going to end up throwing it away. So it's important that you check what's already in your pantry, check what's already in your fridge. Try your best. I know this is a hard one. Try your best not to go shopping while you're hungry. And we say this because it's very, very common that if you were to go while you were hungry, that you would purchase things that are really outside of your list and you end up spending more money. And a lot of times, once you go back home and you eat dinner and you look at all the items that you bought, you think to yourself, why did I buy this? We don't even like it. So it's important that you think about what kind of, maybe even just a snack. If you don't have time to eat a full dinner, that's fine. Maybe you can just eat a snack before you go. Of course, check the grocery store circulars. Sometimes there's deals that you don't want to miss out on. You can check that at the store, depending on what store you shop at, or even online. Learning to read the nutrition facts label. Why should you do this? Reading the nutrition facts label will help you from a nutrition standpoint make better choices while you're at the grocery store. There are some grocery stores that already have programs in place to help you make better choices, but not all of them have that. So it's important to learn to read the label. And of course, reading the label takes a bit of practice. So the first time you go to the store might take you longer, but the second and third time you will develop kind of a skill. And one thing I always say, and we're going to dive deeper into nutrition facts label in just a minute. But one thing I say that's important about reading the nutrition facts label is that you think baby steps. We don't need to make sure we're looking at every single item on the label. We could pick one goal and aim to achieve that one goal. So let's say your goal is, I want to reduce the amount of sodium in my diet. So then every time you look at the label, you look at the serving size and the sodium. That's you setting a goal. And we always say that setting goals, the small ones, make a lasting impact over time. And we'll get into that a little further when I go onto the label. So grocery shopping tips. Organize your grocery list by category. And we say category, it could mean food group, okay? One really good app is the Grocery IQ or even Ibotta. But another really good resource that's not on here that we'll make sure we provide for you in the chat box, or even just listen to me say it on the presentation, is the My Plate. You know, starting simple with My Plate is an app in itself that people know about. That's a government resource. But even going choosemyplate.gov and typing in grocery lists, there are actually templates you can just print off and write in the categories. And sometimes they're divided based off food group. So we'll divide fruit, vegetable, grain, dairy, and you'll jot down every item that you're going to plan on purchasing in those categories. So why should we care about that? Well, it's important that we're actually eating from the 5 food groups. And those are the ones I just mentioned: fruits, vegetables, dairy, grains, and protein. So that's how the lists are divided on that website. So you can print it out and just make sure you're getting those different food groups. Incorporating sale items. Price comparison, making sure that you're comparing prices. Sometimes you're comparing the brand name with the generic. And, you know, a lot of times it's the same product, right? And it tastes the same. It's just a lot less expensive. And of course, I mentioned that there are apps that can help you with comparing prices. And those are the examples. So you have Grocery IQ that helps you organize your list, and also Ibotta that can help you with different tips for grocery shopping. So here's where we go into reading the label. Remember what I mentioned earlier. Trying to pick 1 or 2 goals when you're reading the label is completely okay. What I'm going to do right now is go through a little more extensively the label and what to look at when you're reading it. And again, it takes time to master this skill. So we have the Start Here box, which is in purple. And what I mentioned is starting on the label is important to look at the actual serving size per container. This is how you know what you have to multiply your nutrient amount by. So oftentimes people will tell me, well, I know it's 2/3, but I ate the entire thing. Or I know it said half of the can, so does that mean I'm supposed to double it? Yes. So you look at the serving size so you know what that number means to you. So if you did eat the entire can, then you know it's a little more than what that number is listed as. Checking the calories is one component, but what we really want to make sure people know is quality is just as important, not just the quantity, okay? So it could say 200 calories, but it could be very nutrient dense versus 200 calories of something that might be not as nutrient dense, okay? So when we're comparing, you know, a can of vegetables to a bag of chips, obviously we know that the can of vegetables is going to be a lot more nutrient dense. So making sure you look at the quality to the number of calories. Limiting items like saturated fat, which we know we want to kind of reduce due to its risk for heart disease. And we're not saying to eliminate, it's really to reduce it. Sometimes people are trying to control for the amount of sodium. That's an important component as well. And then things you want to eat more of, looking at the fiber component, okay? Sometimes we hear a lot of times that fiber provides a protective effect against heart disease, and that's something super important. So fiber is one thing you can look at with the nutrition facts label, and also even added sugar. A lot of times people will ask me, you know, am I looking at the total sugar or am I looking at the added sugar? Well, it depends. It depends on really what your goal is. Maybe your goal is you feel like you're eating a ton of added sugar and you're adding sugar to your diet, whether it's in coffee or tea, or eating a lot of desserts. So you want to look at that added component. That's where you can actually see on the label. Now the new label actually says added sugar, not total amount. And so added means they added it back to the product. Something like total sugar could also mean it's, or total carbohydrates could also mean naturally occurring sugar, okay? So it could also be the sugar that's in something like fruit, which is not usually what we tend to tell people to steer away from unless they're looking at the total amount of carbohydrates. So it might be in the case of diabetes or something. But, you know, that's not what the topic of this conversation is. I don't want to dive too deep into chronic conditions. If you are interested in learning more about chronic conditions and how to manage your chronic condition, definitely seek out a registered dietitian because they are the national experts in helping you do so. We have, if you're local in Leon County, there are also dietitians you can tap into, but also on eatright.org, you can look for find an expert and find one in your area. You can go to the next slide, please. Thank you. So really a quick tip I'm going to give you about canned versus fresh versus frozen. We oftentimes hear, well, shouldn't I just be eating fresh fruits and vegetables? Well, of course, the ideal scenario is that we're tapping into our fresh fruit and vegetables at the grocery store, but maybe that's not what's readily available or accessible. It's completely okay to have frozen, even canned. And we'll talk about the pros and cons of each of those. So fresh, it really helps create a variety in your diet because you're constantly trying different fruits and vegetables, especially ones that are in season versus out of season. Making sure that you really purchase in season can help you save money. Being able to touch the fruit or vegetables, smell it, see it before you buy it is also a benefit. Some of the cons is they go bad pretty quickly, so you have to use them before they go bad. You need to learn about ripeness and storage. That's important. And then sometimes it can cost more if it's not in season. So some of the tips with fresh is you can purchase fresh produce when it's in season, asking the produce clerk how to select one that maybe you're not familiar with. It's a unique fruit or vegetable you haven't tried. Purchasing enough just for 1 week. I think this is an important tip because oftentimes I hear people buying those giant bags of apples and then the apples just go bad. It's okay to just purchase 1 or 2 apples, especially if it's just you as a caregiver and your loved one and it's just not that many people in a home. Of course, now moving on to frozen. Frozen is great because it's frozen at its peak freshness and it really conserves or preserves at that nutrient level. So it's a great option, especially because we know that we can store it. It has a long shelf life in the freezer. It can cost less compared to produce that's in season or out of season. And it requires a lot less preparation. And of course, it's available year round. Sometimes frozen produce has a little more added sodium or added sugars and fats. So really looking at the label if that's something that's one of your goals. And then the texture changes whenever you freeze them. Some tips for frozen is to choose frozen fruits and vegetables that have less sodium or added sugar to them. And then canned. Let's move on to canned. So canned is also canned at its peak freshness. But sometimes it can cost less compared to an out of season produce. So it's important that we know that it's less expensive when it's out of season. It does have a pretty long shelf life as well. Little preparation is required and it's available year round. 1 con or 2 cons for canned vegetables and fruits, it may have added sodium. Just learning to read the label and even looking at the front of the label, you'll actually see where it says, it might not say anything has been removed from it, but sometimes it'll say half, the amount of sodium, or it might say less sodium, or no added salt. Okay, so no added salt means they They didn't add any salt. It's whatever was in the product, just knowing that it was still preserved from a heating and canning process, and not from the sodium. And that's okay, but sometimes the sodium's in there just for taste reasons. So you can really look at a label and see if they added the sodium in there. And of course, remember, you check the serving size just to make sure that if you've eaten the whole can, that you know how much you're getting. And of course, the texture changes whenever you can something. Some tips for canned is you can choose canned vegetables that are lower in sodium, and that's something I mentioned. Choosing fruits that's canned in juice and not syrup or very heavy syrup. And then you can also rinse the canned vegetables before you use them to reduce the amount of sodium that's in there. So now when you get home, it's really important to actually streamline your kitchen and organize it so you know where things are. This will help you kind of clear the area to kind of do some advanced prep work. And sometimes people hear about meal planning and they think we mean that means you need to prep the meals throughout the week and really like freeze or put them in the fridge. It's really not the case. You could easily prep the day before by chopping the vegetables and putting them in the fridge and then preparing them the next day. That's still prep work. Planning for leftovers and incorporating them into new dishes. Making one-pot meals to save you on cleanup time. Prepare extra servings to create your own frozen meals. Those are all things to help you save time in the kitchen. Tips for using fresh produce before it goes bad. This is one that Laurie kindly added in here because it's oftentimes we really get this, like, I left it in the fridge for so long, I bought a whole bag, I didn't know what to do with it. So chop and store your produce in the freezer to use it in smoothies. Add vegetables to soups, stews, casseroles, pastas, sauces, and omelets. Top your cereal with sliced fruit. Combine fruit into fruit salad or cook a tasty fruit dessert. Use overripe produce in muffins, breads, or on the top of pancakes. And then combine vegetables with salad dressing. Choose low sodium versions, of course, or make it as a side dish or a snack. Cross-utilization is super important. What does that even mean? It means if you're going to purchase something like 3 or 4 or 5 or 10 apples, that you're not just making one dish with it or one dessert with it. The same thing with vegetables, is that you're really preparing to cross-utilize those ingredients. It helps you save money. It encourages you to get creative with your dishes, encourages you to plan more, and allows you to incorporate more fresh foods in your diet. So I'm going to end with some tips and takeaways for meal planning. Meal planning does not have to be difficult. You can really start small, even if you said you wanted to plan one meal for the entire week, and just build from there. It can help you save money and reduce waste associated with fresh food expiring. And learning ways to cross-utilize your ingredients can really help you save money, time, and even eat more nutritiously. And the last, utilize your resources available to make meal planning easier. You know, the tips that we talked about with the grocery store circulars and reading the label and really creating that list from the choosemyplate.gov to make the shopping list. And even as simple as not going to the grocery store super hungry. So all of these are tips that you can apply to your everyday life that will really make and hopefully make your daily situation, let's say, one less thing to stress about, making your day-to-day life a little less easier when it comes to picking out nutritious food for you and your loved one.
Well, thank you so much, Afaf. That was an outstanding presentation.
You're so welcome.
I learned so much in a short period of time. I'm so glad that we can circulate your slides to the audience because there's so much there and it's so helpful. Have a couple questions for you. Is that all right?
Sure. Of course. Of course.
Okay. For adults with dementia who may be reluctant to try new foods that may be healthy, do you have any suggestions for how to negotiate healthy eating for persons with dementia?
I think it's really important to know what foods the person with dementia actually like. And I know that may change from time to time, but really gauging what type of foods they like, even if it's asking it on a daily basis or asking it once you go grocery shopping or allowing them to choose the actual items with you. And then the other thing would be to make sure you're preparing it in a way that your loved one actually likes. Okay, so there's so many ways to prepare healthy food, grilling, different seasoning, and of course, we always talk about sodium. That's one thing people ask me about all the time, especially in our older adult population. Using different seasonings like Mrs. Dash doesn't have sodium in it, but provides a lot of different good tasting seasoning. So adding that to different produce can help too. And I would say, I think this is definitely easier said than done, but trying not to give up too quickly. So what I mean by that is maybe today wasn't a good day to try it, but maybe tomorrow it's better. And just realizing that kind of gauging and asking those questions from now and then will really help kind of move in that direction, because you never know. Maybe one day it doesn't taste good, and the next day, if you prepare it differently or you try it in a different way, it just might work.
Wow, that was so helpful. Excellent comments. One other question. Maybe this is selfish on my part, because I'd really like to learn this from you. You said that both frozen and canned food, forgive me, frozen and canned foods are canned or frozen or canned at their peak level. What does that mean, and how is that determined?
Oh, well, that's definitely a lot more scientific than I would probably go into at this point. But just knowing that whenever you take a produce item and you have to it travels through different supply chain methods too, sometimes things become more ripe. And so that depends on whether it's in season or not. So that's another complicated path I would go in. But just bottom line, knowing that if that strawberry is frozen at that point, then it's not going to lose its nutrition value. And so sometimes people think that if it's fresh versus frozen, that the fresh has a lot more nutrition value or nutrients in it, but just know that it was frozen at that point in time. So once it's unfrozen, that's where it starts for that process starts to happen. So just know that you're gonna get something nutritious. And oftentimes I think it's a misconception that people think that they're not going to get something more nutritious than fresh. And that's just simply not the case. And same thing with canned. Yes, canning does remove some of the nutrient value, but I wouldn't say to the point that it would be something to be concerned about. I think oftentimes people forget one really important thing, and that's the goal is to get more fruits and vegetables in your diet. And that's something as Americans, we are deficient in. So I think bottom line, if that's your goal, whether you got it fresh, frozen, or canned, it is completely fine. It's because your goal is to get them in. Now, if your goal is to also reduce sodium, then I would definitely consider having the frozen canned or getting the one that says no added salt.
Excellent. We have thank you, Mr. Irvin Ellis, for your question. I'm going to read this to you, Afaf. It's what should I be wary of when purchasing frozen? You kind of hit on this frozen meals. I tend to do this for my mom when I don't have much time to cook. Thank you for bringing this question, Mr. Ellis. I've wondered about this myself.
Yeah, I think that's an excellent question. I would say reading the nutrition facts label. It's really important, especially if there's specific goals that you have set for your mom. So if it is sodium, if it is saturated fat, depending on what your doctor's recommend or her doctor's recommendations are for what chronic condition she may or may not have, I would definitely get into learning how to read the nutrition facts label and understanding what type of nutrients I should be focusing on. And a lot of times with frozen dinners and meals, it's the sodium. Okay, so there's a lot of options out there for frozen dinners, and some are actually super nutritious. So looking at how much fruits and vegetables in that frozen dinner is something important, because some are very deficient and some have done a really good job. And then looking at sodium, that's something sometimes you see sodium levels of 1,200, 1,500, 2,000. That's very high for a frozen dinner. If you're looking at something with 500 milligrams of sodium, I mean, that's a lot lower than what you see in the average. So learning to read the label is what I would try to master. And again, that takes time. And then looking at their fruit and vegetable content inside the frozen dinner, because some are super holistic and wholesome, and some even have a really good amount of fiber. So I feel like if you got down the skills to read the label, and again, I'm going to highly encourage you to talk to a registered dietitian, because it really helps understand kind of, first of all, where your mother's care is at in terms of whether there are any chronic conditions or not, but also learning the importance of reading the label that's specific to her needs, or even your needs, if that's something you're also consuming as well. So there's a lot of factors when it comes into reading the label, but I would say trying to make sure that the actual frozen dinner has a good amount of fruits and vegetables, has the different food groups in there, looking at sodium, fiber. So it really comes down to your mom's individual needs, but also some of that can get complex. So sitting down with a registered dietitian, I think, would be super helpful.
Well, thank you so much, Afaf. I have at least 5 other questions, but we do have a 15-minute or more question and answer period at the end, so I'm going to save the questions. This has been inspirational. Thanks so much.
You're so welcome. Thank you for having me.
Yeah. And now we have Miss Laurie Osgood.
Hello. Thank you for having me.
Well, thank you so much, Laurie. It is a great privilege to have you here, and we thank you for the opportunity to learn more about buying on a budget and about your work at the Qasem County Extension Service.
Okay, great. Well, sure. So first of all, like Afaf was talking about, wellness is not just nutrition. I mean, nutrition is the most important thing that we can do for ourselves, but financial wellness kind of goes hand in hand with nutritional wellness. So today we're going to talk about budgeting, and we're going to talk about the price of food, because you guys know food is very expensive right now, right? So we need to learn to budget so that we can stretch our dollars. So what we're going to do first is we're going to learn about our money personality, because believe it or not, we all have one. We all have a different personality. Sometimes they kind of overlap, sometimes they evolve, but we do have our own money personality. So let's look at some of those. Okay, so there are a lot of different information out there, but I picked these out because these are the more common types of money personalities. We have our savers, we have our spenders, we have our givers, we have those risk takers, and then we have the people that just worry, right? So most people identified with at least one of those, but like I said, sometimes they're a little bit, they kind of cross over each other. But as we grow and as we age, and when factors in our lives change, they kind of evolve with us. So let's look at each one individually. So first thing, we're going to look at those savers. Savers are natural savers of money, right? Everything they do is about saving money. It's kind of a source of pride for them to get something for less, right? They get really excited if they get a deal or a bargain, and it just makes their money grow in their bank account. Sometimes they are organized and responsible when it comes to their finances, almost to too much of a degree, right? But they understand the cost of maintaining a family, and they take time to think about those purchases. And when you're a caregiver of a family member, it's real important for you to talk about those ideas with your family. Some of the bad things are that you can become overly focused on those goals. And you could become anxious, over anxious. We're going to talk about our worriers here in a minute, but even savers can become overly anxious about the ultimate goal, which is saving money. So sometimes savers have a hard time parting with their money, and this can come across as cheap. So nobody wants to be thought of as cheap, right? Okay, let's go to the next one. Then we have our spenders. Spenders are the people who are ready to spend money at anything. It's important for them to put together a budget. They usually have trouble sticking to that budget, though. Spenders get a thrill from purchasing new things. Whether it's a new pair of shoes or a new car, they get the same thrill out of spending money. They tend to live in the moment, and they don't think twice before they make that purchase. But spenders also get a joy out of giving money to others. Some of those cons, you could also be an impulse buyer. You purchase on a whim, and sometimes you regret those purchases. Okay, next one. Then we have those givers. I'm sure we have lots of givers out here in the audience with, if you're a caregiver, you tend to be generous with your time, your affection, but also your money. You're quick to give when asked. You love the freedom to respond with your heart. We all know a giver, right? Emotional giving isn't wrong. Just to remember to think of yourself or your family first. You might find joy in blessing someone who isn't expecting it. Some of the bad things about being an overgiver, though, you're the first person that everybody comes to for help, right? And you may get disappointed if you feel like someone's not appreciating your generosity. And this can cause harm to yourself and your family. And we don't want that. Okay, go ahead. Then we have those risk takers, right? They're the ones that take big chances when it comes to money. The people who play the lottery all the time, or the people who maybe do risky investments. They're intrigued by the possibility of making more money, even if it is risky. They tend to be big picture people, and they aren't afraid to make big decisions. But usually it's after they've talked to their family, or they've done it, that they talk to their family. So that can cause some frictions. So people who are risk takers need to kind of take a step back and do some research before they do that spending. Okay, next one. Then we have the worriers. We're all worriers, right? Especially right now with everything so expensive. But worriers who have this as a predominant money personality are always worried about money, whether that's real or just in our heads, right? You have no confidence in your ability to save money or spend wisely, or even just a little less confidence in your ability. You regularly obsess over the worst case scenario that will happen if you run out of money. It's not really a bad thing to worry a little bit about money, right? Because that's just reality. But by being a worrier, your money and your budgeting will always be a source of stress in your life. And we don't want money to become stressful, right? Because stressors like money really have an effect on your health. And whether you're a caregiver of a dementia patient, or you just have some health issues of your own, you don't want to add stress from money to the list of things that we already have to deal with as humans, right? Go ahead. So now we're going to talk about, now that we kind of have an idea of what kind of personality we have when it comes to money, or variation of all the different types combined, it's important for you to understand those characteristics and how to apply it for budgeting, right? So we all know that groceries are expensive right now, and money's tight for most of us, probably all of us. And when we're a caregiver for a family member, it's important to stretch our money as far as possible. So let's talk about some ideas. Okay, so here's some tips. And a lot of this Afaf has already talked about, but I think it's worthy of repetition here. So first thing is budgeting. We're going to talk about calculating the food costs. How do you save money if you don't know what you're spending, right? Because getting a basis of what you normally spend in with your family is an important way for you to start learning how to save, right? And creating a food budget. And we're going to talk about that in a minute, because that's really important. Planning, like Afaf said, looking at store brands versus name brands. I don't know about you guys, but I tend to like the store brands. Sometimes they're called generic, right? I don't think there's too many things I've ever tried that I think taste worse than a brand name. And brand names tend to be more expensive. So, experiment. Now, I know, like we talked about, if you have a family member who just refuses to try, the store brand crackers, then it doesn't save you any money by buying those, right? But you can learn what your family prefers. And then, like Afaf said as well, planning your meals and your snacks is a really important way to save money as well. Making a grocery list. We're going to talk about that a little bit more in a minute, but making a grocery list is really important. Also checking for ads, sales, using coupons. And then don't go to the store hungry. I'm going to say this 3 more times, because I really, truly feel that is one of the keys to not overspending. As far as like going to a different grocery store, where I live here, I have at least 3 really nice, the type of grocery stores. They're really lit. Everything's beautiful. It's really clean. Everything, the ads everywhere. It's a lot more expensive. It's convenient for me to drive half a mile to those grocery stores, But going a little bit farther to maybe a mile up the road, there's a grocery store that's a little bit less. I can get more for my money. So sometimes thinking about location is really important as well. So think about those things, and also keep up with the ads. I'm a big on Thursdays when the sales change, I see what's on sale because I know it's for my family. I know what my family likes. So I'm willing to go just a little bit farther if I'm going to save a lot of money. And then preparation, like Afaf said, think about the fresh, frozen, and canned and how you can utilize that in your budgeting for food as well. Consider meals that stretch your money. I have 3 children, so I'm a 5-family house. So, groceries are really expensive, and all 3 of my kids are college students. So you can just imagine how much groceries I spend or I buy on a regular basis. So I think of foods, recipes that I can make that I can stretch, or I can even freeze, or I can refrigerate for a couple days. Things like spaghetti and chili and soups and stuff like casseroles really stretch my food dollar. And then look for those low-cost recipes, like I mentioned, because you can save some money that way. Okay, go ahead. Okay, so I wanted to show you this. Like I said before, you really can't budget until you know what money you are spending, right? What is the cost of food? So I'm going to show you this food calculator that's based on the USDA's low-cost food plan. So let me show you this. I thought this was really exciting, and I hope you guys do too. Let me take a second. Okay, so I'm going to get it a little bit bigger so we can see it here. Okay, so basically, the University of Idaho, it's an extension program, just like the extension program that I work for the University of Florida, but they have this really cool food calculator. It's by, like I said, USDA, and it's based on the low-cost food plan, so it's pretty realistic. So what you would do, you'd come into this, and I'm going to send you guys the link. I'm going to give you the link at the end in the chat. You come in here, and it's going to estimate how much it should cost to feed your family using the USDA's low-cost food plan, like I mentioned. So you're going to compare what you are spending for food based on this calculator, based on your family situation. So for our demonstration purposes here, we're going to say we have 3 people in our family. We're going to click. I'm going to say, okay, first of all, I'm the female. I'm going to do me first, right? So I'm female, 51 to 70. How many meals do I eat a week away from the home? Let's say I eat 2. All right, the next person in my family is a male. He's an older person that I'm caregiving for. He eats 2 meals a day with me, away from the home, 2 meals a week. And then I have my daughter, who is, she's 19 to 50. She eats out a lot more than I do, right? She eats out 4 times a week. And you see, based on this calculator, based on the information I just provided, I'm going to need at least $116.82 per week to feed my family. That's $506 per month for our household. This is a great place to start, right? It's a really good place to understand how much a family of 3, based on these are national averages, so it's pretty realistic, how much I should expect to spend. Let me stop sharing and go back to the slides. Okay, so based on that, now we know how much we have to spend, right? So how are we going to budget it? So what you really need to do is create a budget, but you need by determining how often you shop for food. Do you shop once a month? Is it based on your income? Do you shop once a month? Do you shop every week? Do you go every day, which is a big no-no? Or do you shop just when your family needs things? It's really important to understand that. Also tracking your current spending, like I said, budgeting, keeping a food cost log, just as important as keeping a food diary. A food cost log is really good. And I'm going to give you some examples in a minute. One budget buster is eating out in restaurants. As you can imagine, it's pretty expensive. Now, we all work hard. We all deserve to splurge sometimes, but it's best to wait until you have a clear idea what your budget is before you really eat out too often, right? So we'll need to plan accordingly for those scenarios. My last tip here is to keep a grocery list on your fridge. I know Afaf talked about this, but from more of a budgeting perspective, it's really important for two things, right? First of all, if you keep a grocery list on your fridge, you tend to be more in control, right? Two ways. First of all, if you know what you need, you're going to have less trips to the grocery store, right? Because if I don't know what I need and I go grocery shopping and I go, oh gosh, I didn't get milk, right? I'm going to make another trip back to the grocery store. And what's going to happen? You think I'm going to walk in there and walk out with just milk? No, I'm going to spend a lot more money that I might not have necessarily purchased or bought if I didn't have it on my original list, right? And that comes to, like I said, with going to the grocery store when you're hungry. Don't ever do that. And then the other one is going to the grocery store without a list. What do we end up doing? We wander the grocery store. We don't really have a plan. We don't have a direction. We just shop. And that leads to impulse buys. That leads to buying things we don't necessarily need. And those tend to be the more expensive items that we purchase, right? So try to make sure you're more strategic about your budget and about your grocery list. Okay, next one. Okay, it's really important to plan and prepare, right? Like I mentioned, store brand versus brand names. I personally feel like store brands are good. The generic brands are good. Try things out for your family. Like I said before, if your family doesn't eat it, you're not saving any money, right? But you really should at least try. And check those coupons, check those weekly sales, like I mentioned, because that's where you really can save some money. And then buy in bulk when possible. Buy some things like your flour and your sugar and toilet paper and maybe coffee. If you buy those things in bulk, you'll save a little bit of money. And then you might reduce those food waste. Like Afaf said, don't buy a big bag of apples if they're going to go bad, because we all know fruit's expensive. So it makes me cry when one of my apples have gone bad, right? Make sure you don't waste food, because that's just money going out the window. Now, how many of you guys love your leftovers? I was raised with leftovers. My father never met a leftover he didn't like, right? So I was raised to really enjoy leftovers. So when you get leftovers, or when you have leftovers, stick it in the fridge, stick it in the freezer. Make sure you put it in there pretty quickly, because food safety is important, right? But put those foods in the refrigerator and the freezer and take them out the next day. Unfreeze them the next, thaw them out properly the next day or later that week, so that you have some food. And it goes a little bit farther, like casseroles and that kind of thing. And I'm going to say this, I think this is the third time I've said it. Eat before you go to the grocery store. You will be amazed at the difference. And then one more thing I wanted to tell you. Two more things. There's a lot of really good apps out there. One I really like is Nerd Wallet. If you Google Nerd, N-E-R-D Wallet, one word, there's an app for it in your phone, but you can also Google it. It's a really great budgeting tool. It walks you through the process. It asks you the questions, and it creates a budget for you. So I highly recommend that. But there's also ones out there too. So just look around for them. Also, the University of Ifas extension that I work for, they have a series of publication called Money Matters. It's a really great tool that goes into a lot more of the information I've given you. If you're interested in that, here's my email address. I'll be glad to send it to you. They're really worth the reading. I also have the link here to the UF IFAS Extension Family Resource Management Program and the Healthy Living Program that I'm a part of. So thank you very much.
Wow, Laurie, what a stimulating presentation. I'm going to go look at the Nerd Wallet shortly.
Yes, it's wonderful.
I'm a nerd. I think I may gravitate to that.
I'm a nerd too, right?
Oh, we have a question for you from Victoria Fox. Sometimes leftover.
I totally agree.
Comment or better. It was an affirmation for what you said.
Yeah. Casseroles especially. I love casseroles the next day. Absolutely.
We got others. Ken Houston, I like to put leftovers in the freezer for quick meals later.
I must admit, Kendra's my friend, and she's a fellow IFAS extension person. I know she's a great cook, so thank you, Kendra.
Question for you, sort of, maybe it's not a nerd question, but it could border on it. What does IFAS stand for?
Institute of Food and Agricultural Sciences.
And that's located where?
That's out of Gainesville, but we are extension, which means we extend the evidence-based information that is gathered from the university or research at the university and extend it to the community all across the state of Florida and all across the country, actually.
Yeah, well, that's a thank you, because they should know about IFAS is dynamic. And,
yes.
And you're an excellent representative.
Well,
and
thank you.
And dynamic as well. Question for you. Uh-huh. You started talking about personalities, which intrigued me. Is it possible for example, for someone to change from being a worrier to a saver? And if so, are there tips that you might provide?
Absolutely. Well, if you are a worrier, as an example, it's a good idea to kind of think about where that worrying is coming from, right? Is it, were you raised to worry? Have you had something happen in your life that's caused you to be a worrier? So sometimes identifying where that's coming from is a great way to move to another personality, because it is possible to move. We're probably all going to be worriers. I'm a worrier. It's ingrained in my, psyche, but you can learn to be less of a worrier and more of a saver, or more of a spender if you really need to, move to another category.
One last question. There'll be others during the question and answer period following Tomeka's presentation. Are there nutritional differences in between store-bought and name brands?
That's a great question, and Afaf will have to tell me if I've given the right information here, because this is more, she's the pro. But personally, from my perspective, I don't see, and reading the label is important, because every item is going to be different, obviously. But personally, I don't think there's a whole lot of nutritional differences, as long as you're making sure there's low sodium, low sugar, and the items that are good for your family.
Thank you so much, Laurie.
Sure.
I look forward to the question and answer period. Fascinating, informative, and also I think piqued my curiosity about the app. So I thought this is a great opportunity to give this workshop has provided our audience with opportunities for further study.
Yes, exactly. And don't forget about those Money Matter publications. They're wonderful.
Oh, all right. Thanks so much, Laurie.
Sure.
And now, folks, we're going to be moving to our third presenter, Tomeka Norton-Brown, ACTS2 Project Coordinator. Welcome, Tomeka.
Thank you, Dr. Chi. And good evening, everyone. What I'm going to do is give information on our ACTS2 program. If you could go to the next slide, please. Okay. ACTS2 serves all the state of Florida, and we have three primary objectives. The first is to do presentations like we're doing tonight, where we increase dementia awareness and knowledge through presentations and workshops at faith, community, and elder care venues, as well as through social and print media. We also provide brief telephone-based problem-solving consultation and referral services to African American dementia caregivers and other stakeholders. And we deliver faith-integrated skills training and support to distressed African American caregivers of older adults with dementia. Let me just pause here to say that for those brief telephone-based problem-solving consultation and referral services, those are actually available to any person, regardless of race, regardless of location. I'm going to give more detail on our 12-session program, which is for African American caregivers, African American family caregivers residing in the state of Florida. Next slide, please. Our 12-session program, it includes 7 group skills building. So there are 3 caregivers, 1 group facilitator, and 5 individual sessions. I will also punctuate that everything we provide is free for the caregivers. So there's absolutely no charge to participate in our program. And all sessions are delivered weekly over toll-free telephone by trained lay pastoral care facilitators. So we use a toll-free teleconferencing system, and you'll hear us talking about lay pastoral care facilitators. Those are basically lay persons from the faith community who have either self-identified or been nominated by their judicatory leaders to deliver our sessions. We actually train them to be able to deliver the sessions. As I said before, there's 7 group skills building and 5 individual sessions. And in those individual sessions with the facilitators, the caregivers get to focus on goal setting and problem solving to address concerns identified by the caregivers. When caregivers come into our program, they have 2 or 3 things that they would like to work on. Some of them are caregiving related goals, and some of them are personal goals. But they get those 5 individual sessions to work one-on-one with that facilitator to address those concerns. Next slide, please. Okay. Here are the contents of our skills building modules. We have 6 major components. So the first is what we refer to as Dementia 101, which is an overview of the basic characteristics of the dementias, just giving information on what are the different stages, what are the things to expect in the different stages. We also have relaxation training that's combined with calming prayer and or meditation. Yes, we are faith-based, so there is prayer and meditation in conjunction with our relaxation training and all elements of our program. We're faith-based, but we're also ecumenical. So if a person does not profess a particular faith or not a faith at all, it would not stop them from being able to receive services from our program. We also do effective thinking about the challenges of caregiving coupled with scripture. So just coupled with scripture. So just changing the way that you think about your caregiving situation. Next slide, please. Okay, we have my favorite module, the Me Time module, building in pleasant daily activities as a guard against emotional distress. So just being able to negotiate, talking and getting 15 minutes so that you can take a walk or listening to your favorite type of music. We also do communicating effectively with the care partner with dementia, with other family members, and with health professionals. And then lastly, developing those effective problem solving skills through the personal goal setting. Next slide, please. Here are some dementia care resources. There is the Alzheimer's Association, the Alzheimer's Foundation of America, the Florida Department of Elder Affairs, the Elder Helpline, the Elder Care Locator, and the Alzheimer's Disease Education and Referral Center. Next slide, please. How to contact ACTS2. There are multiple ways to contact us. Interested caregivers and other stakeholders can learn more about ACTS2 by telephone, email, or through the web. We have a toll-free number, 1-866-778-2724. My local to Tallahassee cell phone number, 850-274-4945. My email address, tnnorton@fsu.edu. You can contact us here on our Facebook page, ACTS2 Caregiver Project. You can send us a private message, and we will actually respond to those messages. And we also have our website, www.acts2project.org. And what we're going to do is bring up our website and give you a little tour and show you what's available on the website. So if you'll bring the website up, please. And while we're waiting for the website to come up, I will just punctuate again that all of our services are absolutely free. There's no cost to participate. And even if you just have a question and aren't quite sure where to start, please reach out to us and we will make sure that we can help in any way that we can. Okay, here on our ACTS2 website, if you would click um, our homepage, on our About page. This page gives you more information about our ACTS2 program. Kind of talks about the information I provided in terms of the areas that we cover, our participating organizations. If you would go back up and click on links. Here on our links page, it gives links to resources that are available not only in the state of Florida, but that are also available nationally. If you will go back up and click on caregiver resources. I'm here on our caregiver resources page, which is one of my favorite pages on our website. We have prayers and readings. We also have information on the basics of dementia. So here you'll find fact sheets. Here you will find information on dealing with difficult behaviors. And we've kind of put everything in one place so that it's easily accessible for you. If you will go back up and click on donate, please. Okay. The ACTS2 is primarily funded by grants and by private donations. So if you're interested in learning how we are funded or how you can potentially help support ACTS2, you will find that information on our donate page. And if you would finally click on sign up. If you are interested in learning more about ACTS2, or even if you just simply have a question, you can come to this sign up page, fill in your information, put your question. This will route to my email address, and then a member of the staff will be back in touch with you. That's the information on our ACTS2 program. And as I said before, I encourage you, if you just have a question or just not sure where to start, reach out and we will gladly assist in any way that we can. What we're now going to do is to bring all of the panelists back up and we will do our Q&A and have a panel discussion.
Wow, three outstanding presentations. So needless to say, we have questions, panelists. I hope you're ready. I guess I'll start out, and then if we have audience questions, we'll. Oh, there we go. Victoria, thank you for responding again. I deal with chronic pain and disabilities. Can nutrition affect that?
I'll take that one. To be completely honest, without knowing the full scope of what you're referring to in terms of the condition, it's hard for me to answer. I would definitely speak with your provider about it, and then try and get a referral from your provider to see a registered dietitian so they can really look into what that could be.
Other questions, SB, before I shift to questions that we created? Oh, Susan Epstein. Well, thank you, Susan, for joining us. Do you have any favorite healthy casserole recipe websites?
I don't necessarily have an actual casserole website, a casserole recipe, but there's tons of different recipes on eatright.org. I know that's our dietitian, National Dietitian Academy, and they've got tons of really good nutritious recipes. So I would check out that website, but maybe Laurie, do you know of any that you'd be able to reference?
I was going to say the same thing, Afaf.
Okay.
They have great recipes on there.
Okay, I'm going to go ahead and oh, there we go. Irvin's. Thank you, Irvin. The worrier, self-disclosure from Irvin. The worry in me worries about getting over budget and purchasing foods that my mom may not like and end up having to throw away. How can I not get discouraged when this happens? Is it common for dementia patients to have changes in what they like to eat?
I would definitely just answer that and say the trial and error approach, and then not over purchasing, especially when you don't know if she's going to like something. So buying one or two of that item, and if she likes it, then you can purchase more of it. But I think that will help with the discouraging aspect because I think you won't feel as bad. You're like, oh, I bought all this and I'm not going to use it. Or you trying to get something unique that you also might eat or like, that might be more inclined to, you might get less discouraged if you're like, well, I'll eat it because I actually like it. And then I don't know that I have the answer to whether or not that's ever changing in terms of somebody with dementia's taste buds. I don't think I know enough for me to be able to answer that. I'd have to look further into that part of the question.
Thank you, Afaf. Laurie, Tomeka, any comments?
I was just going to say, choose your battles. If there is something that you're never going to get them to eat, don't buy it, because that's just wasting money, So communicate, revisit, and purchase accordingly is probably the best way you can handle that.
Tomeka?
And I would also say, I too am a worrier, and I have been a caregiver, so I completely understand what you mean. What I did with my aunt is I knew the things that she would eat. So there was not a lot of variety in her diet, but to me, it was more important that she eat as opposed to fighting the battle over, well, I want you to eat asparagus. I want you to eat Brussels sprouts. It was just important to me that she ate. So my advice would be to give yourself some grace. Don't worry about the things that you can't control. Yes, those taste buds are going to change. Today she might love potatoes. Tomorrow she may hate potatoes. Next week she might come back around to loving potatoes again. So just kind of take it as it comes. If there are things that you're noticing that she is eating and eating well, then stick with those things. And as they said before, there are different ways that you can cook it. If she likes fish, maybe one day it's baked with this seasoning. The next day it's baked with a different type of seasoning, just kind of trial and error. But give yourself some grace. Just give yourself some grace would be the biggest thing.
Thank you. Quickie question for you, maybe not a quickie answer. And many caregivers, I'm a care partner for my wife with dementia, and there are obviously others of you who are on the program who share this in common. Sometimes we're very busy. Many of us have jobs and during the day, and we're helping out in the evening and caregiving. And the tendency is maybe to want to go for something quick that's going to be helpful for mom or helpful for your husband. Do you have suggestions, Afaf and Laurie, about if you have to go with something quick and you're just tired or whatever, and what are the best foods or types of foods that might be the ones that we would select and those that could potentially be the most nutritious?
I would say fruits and vegetables are going to be your most nutrient dense food items, but honestly, it's trying to get in the food group. So even if you were trying to plan a meal or consider like what could I get, just focus on the components. Ask yourself, did I get at least 3 of the 5 food groups in that meal? And again, the 5 food groups are fruits, vegetables, grains, protein, and dairy. Did I get at least 3 in there? And then, of course, going back to what you and your loved one actually will eat. So I can mention a list of fruits and vegetables that I think are great. But the biggest thing with fruits and vegetables is variety. So it's the color. Those different colors give you different nutrients. So I can't say there's one that's better than the other. But if I were to say if there was something I would choose, I would try to aim for getting at least of those 3 of those 5 food groups. And then to the best of your ability, trying to get in a variety, because I know that's limited as well. But as far as like, looking at your plate and saying, the non-starchy vegetables versus starchy ones, and I won't go too far into that. We know like our potatoes and our corn and our beans, that would be a starch, right? Which is still a vegetable, and that's fantastic. But try to also get in some non-starchy, right? Some peppers, some cucumbers, some tomatoes. That's that variety. The more of that color you can get, the better.
Well, just to follow up with that, Afaf, Laurie, Tomeka, any questions? And I have another one.
I just have to say that
to the questions.
I just have to say what Tomeka said was wonderful. Giving yourself grace. I'm telling you, that is, and I don't mean to sound flippant, and it's kind of like, when we raise our children. Young kids don't necessarily like everything. So you just have to kind of give yourself the benefit of the doubt. You're doing a great job, and just go with it, right? And also think about the foods that you can create, that you can make, whether it's a casserole or some frozen items. Stick it in the freezer on a Sunday and pull it out during the week. It's just as easy to defrost something that you've cooked and frozen as it is a frozen meal. So just give yourself grace, though.
Here's a follow-up for you. This is just a personal one, selfishly speaking. My wife likes cereals, and I don't know, there's a stereotype, maybe it's incorrect, that, the cereals aren't really, they're sometimes filled with sugar and maybe less nutritious. What are your thoughts about that? And are there specific cereals that are more nutritious than others?
Bottom line is reading the label. I'm learning to read the label, looking at fiber content, seeing if the first ingredient of that cereal actually says whole grain, and then looking at the added sugar. So how much fiber, whole grain, and how much added sugar is in that cereal would probably be the three things I would say to look for. But the goal is to learn to read the label and set that goal for yourself to say, I'm going to, when it comes to cereal or a yogurt or something else, I'll understand what to look for when I'm looking at it. So those are the three things whenever we are talking about cereal, we ask people to look at. But there's so many different things and a variety in the grocery store, plenty of healthy options, I would say, for sure.
Laurie?
And like Afaf said, add some fruits, add some. My very favorite breakfast is sugar-free yogurt with blueberries and walnuts, and to me that is like a treat, and it's really healthy, but it's so good. So figuring out ways to take what you have and add some good nutritional components is the key.
All right. So do we have, SB, another question, or should I push ahead? Okay, Cheerios here we go from Susan Epstein. Cheerios with peanuts, almonds, raisins, and banana, and milk. Yum.
Very yum.
You're making me hungry, Susan.
Yeah, Susan, very good, very creative. We should be actually, next time you come, back to the workshop here, we'd love to see you in preparation of your foods, Laurie and Afaf. You could do a demonstration. I think you do demonstrations, don't you?
In my previous role, yes. I don't do them in the role I'm in now at TNH, but we have other colleagues that would be interested in helping do so. Yeah.
Yeah, that's what Extension does. We do
And
cooking
Extension does
demonstrations.
them.
Yes, yeah. So all they'd have to do is get in touch with us, and we could either connect them to their extension agent in their community, or I'm in Gadsden County. Just have to call me.
Excellent. Well, I know. Thank you, SB. You're reading my mind. Thank you. We do have time for one final thought. We'll start with you, Laurie, please.
If I could say this one more time, don't go grocery shopping hungry. That's the key to not spending too much money at the grocery store. One of the keys.
Afaf? Even if you don't have a photo, just do an audio.
I'm actually charging my laptop, so you can go to Tomeka and come back.
Okay. Tomeka, go ahead.
What I would say is just kind of reiterating what I said before, give yourself some grace, do the best you can with what you have. None of us know everything. We're all constantly learning, and don't feel bad if the technique that Laurie uses might not be the technique that I use, but if as long as I'm making small changes, those small changes can have a big effect. So do the best you can with what you have. Take it day by day, step by step, and continue to always walk in grace.
Tomeka, you stole mine. So I was going to say, just remember that the small changes, even nutrition related small changes that you make can make a lasting impact over time. So just like I said at the beginning, when people hear meal planning, they think I have to do all or nothing. And that's just not the case when it comes to nutrition. It's very much a spectrum. And so just remembering that even the small little changes you make will make an impact over time. And like she said, give yourself some grace and reach out to a dietitian if you have any questions.
You know, you'll have significantly greater grace if you reach out to a dietitian, don't you think?
Sure thing.
I would love to talk to you right now for more grace. At any rate, I just want to thank the three of you for an outstanding workshop. This was so informative. It was fun. It was just stimulated ideas for me personally that I hadn't really thought about. And that's just so much appreciated. I want to thank, just shifting gears, I want to thank also our production team, SB Nadombe and Melissa Powell, for producing this program. We're grateful to both of you. I do want to talk to you a little bit about our next Facebook Live ACTS2 workshop before we sign off. Please follow us, folks, on the ACTS2 Caregiver Project Facebook, on our website. Our next workshop will highlight the training and lived experiences of first responders in managing critical care situations for older adults with dementia. We'll soon announce the date for this workshop on our Facebook Live, on our Facebook website. And we thank you. What a great blessing having such a thoughtful and curious audience. And once again, we thank our three presenters and production team. Have a wonderful evening.
Thank you so much.
Thank you.